she didn't even remember eating it. As the days passed, life was normal for JC, but about 5 months ago, and 4 months after that night, JC started having insomnia. She would go to bed at 11 p.m., but would toss and turn. She'd close her eyes, but nothing would happen, and she could watch as the sun would rise at 7 a.m. The day following her sleepless night would be filled with anxiety and confusion. She would feel like her heart was beating in her neck. She dreaded nighttime, knowing she could end up watching the sun rise again the next morning. It was around this time that JC would periodically feel her stomach cramp. It would come and go, and she could feel it jiggle and shake. Sometimes it'd be followed by the loosest and most watery stool she's ever had in her life. She told her husband that it felt like a fish was flapping around in her belly. JC wasn't sure if she was just too stressed or whatever was going on with her sleep. She tried melatonin, she tried essential oils and special teas. Some nights she'd sleep okay, but there was no consistency. Nothing made any sense. JC started seeing little bugs crawl around on the walls. She couldn't see them directly in her field of view, but they would hang around on the sides of her eyes. She could see little creatures creep and crawl around. She was so exhausted from her insomnia that she wasn't sure if it was because of the sleep deprivation, but as the days passed, those bugs on the wall started crawling underneath her skin. One night, while JC was wide awake, she couldn't feel her hands and feet, and as she got up from bed, she felt that her pants were wet as a warm fluid started rolling down her leg, becoming colder the further it dripped down. She realized it was urine, but she had no idea how she let that happen. In the urgent care clinic 7 months after eating the 5-day-old sushi, JC did appear to be healthy. Just looking at her, doctors couldn't find any immediate problems. Her diet was okay, maybe a little aggressive in the calorie deficit, but she exercised regularly. Her blood tests all returned normal. The urgent care doctor didn't really want to tell her that it was all in her head. You know what? Maybe you're just stressed, and maybe we can give you some magnesium to help you sleep, he said. Stress causes insomnia. It causes urinary incontinence. JC's young. She's healthy. She's not pregnant. Medicines might cause additional side effects, so the doctor was convinced cognitive behavioral therapy was the best solution here. JC could maybe sleep 1 night a week still, so there was still some hope. And nobody ever mentioned anything about some days-old sushi that JC ate for dinner one night because JC herself didn't even remember she had eaten it. As she expected, the cognitive behavioral therapy did absolutely nothing for her insomnia. One night, her husband saw her mumbling to herself in the corner. She was shaking and her pants were wet. As she passes out and starts having a seizure, Jonathan calls for 911 and she's brought to the emergency room where we are now. At examination, doctors weren't entirely sure what was happening, but looking at her blood underneath a microscope, doctors find that JC had macrocytosis. Macro meaning large, cyto meaning cell, but